All right. So today, as our guest speaker, we have Dr. Melanie Olivas Longhurst. She is a clinical psychologist and an assistant professor here at Texas Tech El Paso. She's a psychology training director and the Texas Tech part of the consortium with, it's called the El Paso Psychology Internship Consortium that we have together with UTEP. So it's just one of the ways that we collaborate with UTEP. Dr. Longhurst is an El Paso native. She did her pre-doctoral and postdoctoral fellowships, internship and fellowship, and in an integrated clinic, primary care and health psychology at the South Texas Veterans Healthcare System in San Antonio. She joined us in 2018. She is interested in wellness, of course, but the intersection of physical health and mental health, integrated care, and multicultural issues, particularly those impacting Mexicans and Mexican Americans. She has a strong interest in training future clinicians, and she not only helps us with the psychology interns, but also with our psychiatry residents and our child and adolescent psychiatry fellows. So we're so glad to have her today. She's done a lot of work with the entire university here on wellness. And then once COVID hit, she expanded to all of the agencies that we collaborate with. So I know that she facilitated kind of support groups for Children's Hospital, for the Psych Center, UMC, the residents, the fellows, the students. So she has done so much to support us here at Texas Tech El Paso and really the whole El Paso community. And so I present to you Dr. Longhurst. Take it away.
Hi, thank you, Dr. Martin. I'm glad to be here. So today I'm going to be talking about mindful communication in medicine, which I think mindfulness is really important in terms of our own wellness, but it can be integrated and incorporated throughout our day in various ways, and especially in the care that we provide to our patients, to our clients. And so I'm glad, and to each other, really. So I'll share a little bit about that. So this can extend beyond just medicine. So today, what I hope you take from this presentation is that you'll be able to understand what mindful communication is, identify ways that our communication can impact our patient care, and then, of course, take away some skills that you can implement in order to improve communication, not just with your patients or clients, but with others as well in your everyday lives. So let's start with what mindful communication is. So in terms of mindfulness, if you're not familiar with what mindfulness is, it's essentially paying attention on purpose to something. So it's intentional and you're, trying to do it on purpose, or you're trying to focus on something in a non-judgmental way. So when we try to define mindful communication, there are various ways to do that, but essentially it's bringing non-judgmental present moment awareness to your interactions with others. So it means that you're present, you are focused on what is being said, you are focused on how you are feeling in that interaction, in that back and forth between you and other people without judgment. And so it's very intentional. You're putting your attention into that interaction and you're trying not to be judgmental as it's taking place in an effort to be entirely focused on the moment and then using that information and incorporating it in order to understand how to engage in that ebb and flow that comes with communication. So I'll explain a little bit more about the different components and how to integrate this into practice. So there is research. A lot of the research tends to come out of oncology and psycho-oncology, and which makes sense because there are these longer term interactions. But I'm also a primary care behavioral health provider. And so I work in primary care, and it's essential that we engage in mindful communication, that we are totally kind of in the moment, because we will miss a very important information that can give us more context to what the patient is saying. So some of the research has found that mindful communication, is really this critical aspect of diagnosis, and that should be better addressed in medical education. So I'm glad there are some medical students joining us and some interns, these trainees here, because when we are focused on what a patient is telling us and we are entirely engaged in that interaction, we can pick up on the nonverbal information that is being stated, that may give us clues and may give us additional data in order to come up with an appropriate diagnosis, as well as treatment plan. And so we may miss a lot of this information if we are busy typing on our computers and not attending to the patient, if we are essentially ignoring them. When you're talking to someone, it's like the lights are on, but nobody's home. Either you're kind of somewhere else in your mind, or you can tell they're somewhere else. And so the information isn't getting through. Now with, pagers and texts, and I don't wear my Apple Watch anymore because it was very distracting, but we have all these distractions around us, emails, alerts that are popping up. If we're virtual, there could be all kinds of other things that are taking place around us that can pull our attention. So if you're doing any telehealth work, this could be something that you might have to put added attention to, is bringing your attention back when you notice that it's wandering. But other mindful communication definitions in regards to medical care or in the healthcare field is an active process whereby the healthcare provider and patient or family unit are attentive to the timing, nature, and context of the dialogue exchange, and that helps to direct that the patient, the care is patient-centered, reflective, and relational. So just, I encourage you to just sit back for a moment and maybe reflect on a time where you've been communicating with someone or trying to communicate with someone and they're not being attentive. What did that feel like? How did that impact the quality of the communication, and what would you have felt? How did you feel? Did you feel heard? Did you feel seen? Did you feel disrespected? Did you feel frustrated or upset? Imagine all of those things, and if your provider was doing that to you, whether willfully or inadvertently, it happens. And so we have so much, we have all this stimuli in our environment, and so it's really easy to get distracted, and we all do it. We may be sitting there trying to pay attention to something and our mind wanders. It's very natural. So the important part is being able to notice that that's happening and bringing your attention back and really being mindful of the interaction and being intentional of, this is what I'm doing. I'm focusing on this conversation right now. And all these text messages and these emails can wait because this is what's important. And I'm going to take information from this interaction. And this can also help us better manage stress and improve interactions with colleagues and patients because they feel heard, they feel seen, they don't feel ignored, they don't feel disrespected. And so that stress kind of goes away, and it can also really streamline the information that's being stated. I have this book here that's Attending Medicine, Mindfulness, and Humanity. But aside from that, so the bookmark that I'm using is this quote that I found to capture this perfectly. Just the notion of part of what mindful communication is. And this quote is, "I need to listen well so that I can hear what is not said." And we are able to pick up on so much about in an exchange when we are completely engaged in that exchange, because it's not always said, but we're often communicating in ways, even if we're not actually stating anything. So this can be a very useful tool in healthcare, because we're able to pick up, like I said, on that additional data that isn't necessarily said verbally. Research has also shown that effective communication can really impact patient care. So effective communication can lead to improved health-related quality of life and better patient outcomes. Why is that? Well, again, we're listening, we're able to get additional data. We're able to maybe make better diagnoses, as well as formulate better patient-centered treatment plans, because we are engaged. We're not in our minds kind of coming up with our own conclusions and not including the patient. So this isn't necessarily surprising when you think of it. But this is the part that I think is really something, again, not surprising, but something that we really have to consider, is that poor communication can be very distressing for patients, can damage rapport, and can contribute to additional physical harm or poor medical outcomes. And so when you think about it, when a patient doesn't feel heard, when they don't feel seen, when they feel disrespected because they don't feel like their provider has listened, yes, it's going to damage rapport. And then that's going to cause this stress and distress, and they're not going to want to engage, right? So they're not going to want to engage in the treatment plan if they don't feel that you care, or if they feel like you're not interested. They're not going to trust you. And so they might go off, and maybe it might affect them to the point where they don't want to engage with a provider ever again. And that happens. And I've seen many times in primary care and in psychiatry, if they get to, that specialized level of mental health care. But many times what I hear in primary care is, I've had so many bad experiences, and XYZ, or they come in from, seeing they were referred by their PCP out to specialty, some type of specialist. They come back and, I don't think they heard me. They weren't listening. They didn't do anything for me. And we look at the notes, and clearly there were things done, but the patient's perception is what is going to dictate how they proceed with their care. And so it's not so much about, well, I did my job, right, as a provider, and I gave them the information and I told them what they need to do, but rather, how did they perceive that information? How did they perceive that interaction? And now what are they going to do with it? And so what is the point of medicine? What is the point of healthcare? What is the point of mental health care? That's to care for patients, to provide care. And so we can't do that effectively if we don't have their engagement, if we don't have a strong rapport. And by communicating well and by communicating mindfully, we can really strengthen that and strengthen the rapport, and consequently, hopefully improve their health outcomes and improve their ability to collaborate with us and to engage in a treatment plan that we see is going to be effective, and hopefully assist them in achieving better medical outcomes, which is really the goal of what we are trying to do. So how can we do that? Well, there are various things to keep in mind. One is openness. And so when we talk about mindfulness, there's this notion of having kind of like approaching things with curiosity. There's something called a beginner's mind. And that's really, when you think about it, how a child approaches life. It's like the first time you're ever seeing things. So I have two young children. One of them is 2 years old, and she'll look at things, in just like this, from a sense of like awe, and it's something that we might see every day. But what I do is I really stop and I try to look at it from her perspective, like quite literally. I'll like get on the floor and see, like, what are you looking at? And how does it look to you? And it's amazing to see it from a different perspective. And so essentially what openness is in the context of mindful communication, is seeing this person and the relationship almost as new, even if it isn't. Because when we're familiar with one another, or we're already familiar with this patient, we're going in and we're already thinking like, I know, blah, blah, blah. This is what they're going to come in. This is what they're going to say. This is an old issue. We might miss out on a lot of key information that perhaps is even new to their experience, new to their presentation. And if we're dismissing that with our preconceived notions, with this judgment that we're already coming in, and we're not open, and we're not being curious, we can totally squander that. And it could potentially lead us to miss something that is quite important. So it's really coming in from this sense of curiosity and open-mindedness and this beginner's mind. So it's like almost like every time is like the new again, like what, how can I see this as if it were the first time that I was hearing this person's story, that this was the first time. And that's not disregarding what you know, but it's not letting that cloud you and anchor you into, I already know what's going on. And then you dismiss all of the new stuff, often unintentionally and inadvertently. Open communication, mindful communication. So being open to another person's perspective. How many of you, so just think about whenever you hear somebody talking and they might even be saying things that you're not quite interested in hearing at the time, a comment, a criticism, a critique, whatever. You might be tired and just, it's a Friday. You're just ready for the weekend, right? And that may lead you to already be generating responses in your mind. Or, you're already coming up with an argument and you're not listening. How many of you have done that? I certainly have. I'm sitting there and instead of actually taking in the information, I can see the person's mouth moving, or in this case now with masks, like sometimes not even that, right? So we just see them. And in my mind, I'm already coming up with like my rebuttal. And so that's not being open. That is actually being closed and judgmental, because you're already coming up with this argument or this kind of defense that you might be arguing the wrong thing, or you may be, again, missing out on something about their perspective. So it's really good to keep that openness, that open perspective, and being able to see it from a different light, from a different view. And, I really like this being in, when you have somebody else that you maybe is in the room with you, that can also be helpful. So if you have another provider, or if you have a med student with you, or a trainee or a resident, a supervisee, whatever it may be, or just a colleague, it's really nice to be able to hear another perspective, because that can open your purview to something that you may have missed just because maybe you were in your own head and you weren't being mindful. You weren't present. You were there, but you weren't present in the communication. You were present in your mind and what your mind was telling you. And so with mindfulness, what you want to do is be able to notice that you're there, notice that you're already generating these responses, and then gently bringing your attention back to the conversation, back to the discussion. And so another piece of openness is noticing your first thought or judgment and seeing it as just one of many perspectives. So not just getting caught up in that, like, okay, yes, not dismissing that. Again, it's not trying to be judgmental. It's just like, okay, that's one perspective of many, and not getting so caught up in, oh, well, that's not my perspective, so I need to kind of like fight you on this and struggle and engage in that. And what that looks like sometimes in healthcare or medicine is that patients will come in and they'll say something like, well, I think it's this. Have you looked, would you consider this? Or a family member told me X and, so-and-so said Z, and we're already thinking like, well, what do you know? And, I've heard some providers say like, oh yeah, what do they know? They're just like Googling or, looking it up, and they're coming in with all this. And I know that it's just this, but they might have some legitimate information that we can use to incorporate into, again, our own hypotheses about what may be happening. And so that may give us some additional information that can help us to provide better care. And then I'm sure I don't have to tell you this, that in everyday relationships, this can really be helpful, right? That we're not already generating an argument in our own mind while somebody, a significant other, a friend, a family member, somebody close to us is trying to say something and we're like, no, because that's, people will see that as invalidating, and communication just shuts down when we're not open. Empathy. So empathy is another important part of mindful communication, because what you're trying to do is you're being present, you're trying to observe what's going on and trying to identify with how another person might be feeling in that interaction. So that quote, I need to listen well so that I can hear what is not said. There are times that patients present to primary care and they are talking about something and they're becoming very emotional, and it's clear that, and it's not necessarily a behavioral health or mental health issue, but it's clear by their response, their emotional response and how they're emoting, that something deeper is going on. And so if you're not attuned to that, if you're not aware, you're just typing away and not noticing their emotions or not responding to them, not taking note of them, commenting on them, then you might miss out on a lot of key information. And so it's important because it'll give context to why this is such a big concern, or it might give context to what else might be going on, so you can appropriately come to a conclusion in terms of a possible diagnosis, or further tests that need to be done, further labs that need to be taken. And so you can't do that without being present, and as well as identifying your own feelings, what's going on there. And so if you're empathy is about putting yourself in another person's shoes, just trying to imagine what might be going on. What might it be like for that person? If you were in that situation, how might you respond? And many times we ourselves, when we're attuned to somebody else's experience and their emotions, stuff comes up for us too. And so it's about noticing that, not judging it, not even trying to get rid of it or do anything with it, but just kind of figuring out, what's happening for me right now? And how might this give me some information about this interaction that's taking place? And if you're uncertain about another person's feelings, just ask. It's usually better to ask, because we may be off in what we're thinking. I've had many instances where, a trainee might come in primary care and say they're attending, their preceptor might ask something like, well, did you ask about depression or anxiety? And they'll say, well, the patient wasn't crying, so they must be fine. And, I've had to kind of stop and say, well, just because they're not crying doesn't mean that they're fine, and they're like, no, they were smiling. They were very cheerful. And then I'm asked to go in and see the patient, and it's like, just like cue the waterworks. And they're just talking about these, these traumatic experiences and all this stress that they're under, and, on and on. But many times they see this environment as, or maybe I shouldn't be talking about this, right? So with the primary care provider, I'm with a medical doctor. And so they try to conceal all that by like holding it in with a smile, and their life is like crumbling, but they don't feel comfortable sharing that. And it's missed because it's assumed that because they're cheerful and smiling, that they're okay. And then we actually do, some kind of like PHQ-9 just to check in on maybe depressive symptoms, and it's through the roof. And sometimes we're even missing things like suicidal ideation, because we're just seeing them as, cheerful and happy. And that does not necessarily equate to a consistent mood, because of the environment they're in, or they don't know the provider, they don't know that they can express that to you. So sometimes just asking can really help us to, again, get some additional information that can be useful. And then compassion. So compassion is combining empathy with an understanding of the position of the other person. And then this desire to help ease their suffering, right? So when we're compassionate, we're providing compassionate care. We're not only putting ourselves in their shoes, imagining what would it be like for me to be in that situation, but we're also trying to think of, what can I do to help ease this situation? What can I do to help ease this experience that they're having? And, I would like to think that that's probably the reason most of us are here today, the reason that most of us have gone into this line of work in healthcare and mental health care. And so it's really imagining that the person that's in front of you is what could be one of your loved ones, or how might you comfort, or how might you help them in this situation? And so we can oftentimes, if we're not present, we can lack compassion, and it may not be intentional, but we might be kind of in our own space and not realizing like how all of it is coming together. So I'll give you an example of, I know there are times where there are providers who are really exhausted and perhaps have been dealing with a very difficult patient or patient family, and are thinking like, well, whatever, like I've tried everything, they're not listening, they're not compliant, blah, 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 right? So I'm just done. I'm just going to proceed in this way. And they'll come and say, you know, hey, like try to get a different perspective. So they'll stop and say, you know what, Dr. Longhurst, so I'm kind of running into this like brick wall with this patient and his family, and I'm getting really frustrated by them, and they're feeling personally attacked because maybe they're saying things to them that they're taking personally. You know, and I always ask them to kind of step back a little bit. And it's easier as an outsider, right, to offer this other perspective. But, you know, I sit back and think, you know, what if that were me? Let's say I'm a mother and my child has a terminal illness and they're in a lot of pain and a lot of suffering. And I see this day to day. I might start to take that out on the provider. Again, not intentionally and not personally, but I might be upset. I might be frustrated and not know where to take that out. So I might say things that are rude, and I might be very irritable and angry and upset, but it may be because I am very sad and scared and hurt because my child is dying. And, you know, when I offer that perspective, it's a lot different, right? For the provider, when you see it that way, like, oh, it's not about me. They're not upset at me. They're scared and they're frustrated about the situation. And many times it's things that are out of all of our control, but they have nowhere to put that energy. They don't know how to put that out there. And so that's compassion. You have that empathy. You can approach the situation from imagining what it would be like to be in their shoes. And then how might you comfort them in a different way? Because then it changes our response. Instead of like, well, I've done already, I've helped you and you're not listening to what I have to say. So there's not much that can be done. Versus, you know, I'm so sorry. Like, I can only imagine how scary this is. And I might not even be able to imagine how scary this must be for you. Those two responses can really alter the trajectory of that conversation and that relationship moving forward. And so it's really important for us to be able to tap into that and to sit with that, even when we are tired ourselves. And again, it's really easy to not do that and not engage in that space if we are not present and we're not mindful and we're not intentional. It could be really easy for us just to be very judgmental, to take that information and say, well, I'm taking this as a personal attack and I don't have to deal with this. And, you know, I don't have to deal with you and you're not listening. So boom, I'm just moving on. And that is not going to be effective to providing patient care. So hearing versus listening, this is very important. And I love this picture. I mean, talk about mindful communication. I think this captures mindfulness, mindful listening. I think that captures it. Look at his face. Like, he is totally there. He's totally with whatever he's listening to. So hearing is this passive physiological process. So it does not involve deliberate or thoughtful attention. Like, right now, even with these noise canceling headphones, I can still hear my little girl. I can still hear my son out there, and hopefully you can't. But it's not intentional. I can just hear it, right? Because I have this physiological ability to hear this auditory stimuli. And now, this is not a choice, but listening is. So listening is an active process involving being intentional and thoughtful, putting your attention, bringing your attention and your awareness back to the message that someone is trying to convey. So that involves the auditory stimuli. So that involves hearing it. It also involves looking at the body language, noticing the tone in their voice and their facial expressions. And so this is a choice. And again, you can't pick up on all of this if you are not present. And by present, it also means focused on the patient, focus or the person in front of you who's trying to convey this message. And if you're not being intentional about trying to listen, so that means getting out of your own head and actually focusing on the message they're trying to convey through their body language, through their tone, through their facial expressions, as well as what you're hearing. So the words that they're using. So a lot of this also, again, we're talking a lot about emotions. And so being mindful of our emotions also allows us to notice our reactions, how we're feeling, and then bringing our attention back. So, I really tend to tune in, especially when I'm dealing with a difficult, what I perceive as a difficult or angry or, challenging patient in some way. It is a very intentional thing that I do where I start to notice that I'm already getting frustrated and I haven't even gone to the waiting room yet. Or I haven't even gotten to the room because I know in my mind, right, what to expect. But that already is kind of setting me up for disaster or failure because it is already altering how I am moving the communication along, and the patient isn't even in front of me, or the person isn't even in front of me. And so I'm already generating like, they're going to do this and I'm going to say this and blah, blah, blah. And so I'm already getting, frustrated and going out and saying, so-and-so. And I have to check in with myself about what am I feeling? What's going on for me? And I need to just let that just be, let it go, and be present, because that may not be how it transpires. And if I'm already putting that out there, they're going to pick up on that. And then this is going to lead to a very challenging exchange that may not need to happen in that way. So by focusing on how we are feeling, it can also help us to kind of soften our response, soften how we are engaging our own tone, our own body language, our own facial expressions, because we're just willing to be present, willing to listen, willing to be open, and allow our perspectives to be open as well. So we really need to check in with ourselves about what's going on for us. And so when I find myself already kind of generating this own, fortune telling of how an interaction is going to go, then I really notice that is a time for me to very much be intentional and focused and completely engaged in that conversation. And I've noticed that it makes a world of difference. Someone that, I may be perceiving as difficult and challenging, I can really empathize and be more compassionate because I'm willing to be more open to their perspective. I'm more curious about what's going on for them and able to see them more as another person who is struggling, who is suffering, who's in pain, versus who's trying to be defiant, who's trying to be defensive. Oftentimes they're not coming to us because they just want to be, come up with a fight. They're here because they have a problem or a concern. And so if I'm not open to hearing what's going on for them, I can really, do a disservice to the patient or the person who's in front of me. So also, what research shows is our emotions affect how we listen, how we take in information. So that's another reason to approach our interactions with this non-judgmental awareness, is because when we're feeling happy, we're just like, don't want anyone to rain on my parade. So I'm just going to filter out all that information. But that information could really be key to understanding what's going on for the patient. So when we're noticing our own emotions, we can just be, again, more attuned to, all right, so I acknowledge I'm feeling that way and that's okay, but I need to be present and listening to the message that's being told in front of me and not let my emotions kind of get in the way of that. Sad or anxious, we tend to filter out pleasant messages. And then when we're feeling stressed, instead of listening, we're trying to fix a situation, or we might engage in this stress response of like running away. I don't have time for this. I'm not even going to engage, or feeling just stuck, right? This like freeze response of like, oh my gosh, this is so overwhelming. And it doesn't necessarily mean that the stress is coming from the interaction. It means that we're already coming in with that stress. And so when we're feeling overwhelmed, it's like, I just don't even have the energy, right? Screw it. I'm just going to kind of go and take this approach. And that may be not helpful. And so really important for us to recognize how we're feeling. And again, bring our attention back to the focus, which is in this case, our communication, listening to the other person, and recognizing that we may be feeling a certain way, but allowing those emotions to go and not getting wrapped up into them, because we might be filtering out information that can be very useful, or it could impact the way that we are communicating. And that may, when a person wants to be heard, sometimes they just want to be heard. They just want to share something without getting a quick fix, without getting a response, because that can be very invalidating sometimes. Again, reflecting on your own experiences. Can you think of a time where you've just wanted to share something with somebody because you're frustrated? So you just want to vent. You're like, I just want to say stuff. And this other person's like, well, have you tried? Well, maybe if you, well, and you're just like, gosh, this is like even worse than before I came in. That's not what I want. And so oftentimes people just want to be heard. They want to be seen and listened to. And it's very difficult for us to do that if we're just trying to bring solutions to their problems because we're feeling overwhelmed and stressed ourselves. So here's some practice tips. And I want to leave time for any questions or comments. So I'm going to go through these and then hopefully we'll have some time. So taking a deep breath before entering the next patient room. I know this is something that a lot of people feel like, I don't have time for it. But it's actually a time saver, mindful listening, because again, if we are focused on what a person is saying, then we are clued in to everything that's said, and we don't have to ask them to repeat themselves. We're not losing out on information because we're not engaged. Again, kind of this lights on, but nobody's home kind of thing where it looks like you're listening, and then somebody's saying something and you realize like, wow, I haven't heard a word they said. Because you're just like, mm-hmm, yeah, wow, yes. And then you go back and you're like, I don't even know how to respond because I don't know what was said. I've seen that happen whenever I've sometimes been in a room with other providers or just kind of part of a team. I've noticed that sometimes like the person is so kind of involved with typing or getting the information or reading the note, and the patient's been talking this entire time, and they'll stop and they'll say, oh, well, can you tell me about blah, blah, blah? And I'm thinking, gosh, the patient just spent about 5 minutes sharing all of that information, and here we are. And so that's another 5 minutes, and then that's another tangent that we're going on, and it takes up a lot of time. And so I know time is an issue, especially in things like primary care. So it can be really useful when, instead of still kind of thinking about the other patient and the labs and that interaction and that went south, and now we're in front of another patient and we're still thinking about the last patient and that interaction, it's about kind of just like grounding yourself. So before it's stepping into that next patient room, you step away, and it's just about, okay, grounding yourself. I'm right here, right now. Just take a deep breath. All right, new patient, new interaction. Where's my focus? It's going to be with this patient. Again, this is very intentional. It's not just kind of this natural thing, because naturally our minds are wandering. So we have to be intentional about bringing our attention back. One of the providers that is also very much involved with mindfulness share that she likes to do where are my feet? Like occasionally while she's doing inpatient on the floor, she'll just think like for a moment to ground herself, like, where are my feet? Like thinking, okay, what do my feet feel like? I'm right here, right now. It's her way of grounding. So finding a way to ground yourself before your next interaction can really help to kind of almost like cleanse yourself from that. It's like when you're, out at smelling all this perfume and they bring out like coffee grounds or coffee beans to kind of cleanse that I kind of think about it in a similar way. Remembering that there's another human on the other side of that door that's been waiting to see you, that came in to see you, that maybe took several buses or public transportation or walked in 108 degrees, and has been waiting there for an hour for a 15-minute visit. And so while you might be rushed and you might have other things on your mind and have that previous patient interaction in your mind, they don't know any of that. They took all the time, and they're maybe paying a outrageous copay or maybe paying out of pocket to have, 15 minutes of you hearing and listening to them. So that's really important. And then just being able to recognize that we sometimes behave in a certain way that isn't necessarily the kindest or sweetest or most, thoughtful. And they might just be hurting. And so their response to you may not be as polished. And they also have expectations that they came to see you. So trying not to take that stuff personally, but trying to, again, be empathic. And so when you approach your patient with this intention, it's, again, and, it can be tough. It can be tough when we have our own stuff going on, when we are tired at the end of the day, but always just going back to thinking, like, what did this patient have to go through to be here, to see me? And they're not thinking of the 15 other patients that I just saw today. They're not thinking about, all the documentation that I still have to go write up about the notes and all these other requests that I have pending for me. They don't know that. They just know their situation and that they're coming to see you. Respond, but not react to judgments. So again, this is noticing. So it's this awareness of, oh, this thought is popping into my head. I'm coming up with this defensiveness. I'm being judgmental, and noticing it and allowing yourself to just notice it, but not get wrapped up into it and not responding and not reacting in this defensive way. So you're not reacting to it, but it's just, you are responding. You're acknowledging it. You're acknowledging that it's coming up for you. And what are you going to do with that to make this interaction more fruitful? Be a person. Oftentimes it's, it seems so intuitive, right? That, we're in healthcare, but I've been in my own personal interactions as a patient with a provider who just seems like they're not even a person. It's like, where can I get another human being in the room? Because it's just this like robot who's using this algorithm, to figure out what to do with me, and is not taking me into account at all. And in fact, sometimes never even making eye contact or talking to me, because they're talking to like the nurse or somebody else in the room about me in third person. And so I've been in those interactions, and it is terrible, like traumatic in some ways, depending on what the situation is. Using silence. This can be a tough one for people. We want to just kind of like on to the next thing. But silence can be very useful in allowing everybody that's part of it to slow down. It allows us to notice what's taking place for us. It allows the other person to be able to, maybe they just need a pause to get their thoughts together, maybe to realize what they want to say, and how they're going to say it. And so this can really help and aid in effective communication. And so again, you're mindful of what's taking place, how you're feeling, what's going on for the person. It can allow you to also kind of take a moment to really observe how their nonverbal communication, their facial expressions, maybe your own, maybe you're reacting in a certain way that could be altering the way that your message is being communicated to the person, and it may be unintentional. Like, I didn't know I was making that face when I said that. And then reflecting. So this is a really good way to be able to check in and to demonstrate that you are mindfully listening, is by being able to reflect what the person said to you. So they say all this stuff and you can just summarize. So what okay, so, correct me if I'm wrong, but what I heard you say is, you're really worried about this bump that you found on your leg. You've had it for, 3 weeks, and you're really worried, especially because you have a history of cancer. And so you want to make sure that that's getting checked out. And so this is causing a lot of like anxiety and stress for you. So what you're wanting from us today is for us to try to help you figure out what that is, right? So you're taking all of that information and you're demonstrating that you very much heard what they had to say, that you took in how they were feeling, and that you're checking to make sure that you heard them correctly. And you're allowing space for like them to correct you. But again, that's a really good way of, showing them that you heard them, that you were listening, and that you were hearing what they had to say. So both, that it wasn't just this like physiological response, but actually you were taking in their message. And then practicing mindfulness outside of work. So what mindfulness is, if it can help to relax people, and there are plenty of exercises out there, plenty of apps. I think there's one for healthcare providers, Headspace. I'm looking at my apps. Headspace. There's Stop, Think, Breathe, including Stop, Think, Breathe for kids. And so looking up some of these resources and practicing, it can help you with your own, to help manage your own stress. So there's a lot of research behind mindfulness and behind mindfulness-based stress reduction. But it also, the whole purpose is not necessarily to relax, although people do experience a sense of relaxation. But it does, in terms of the whole goal is helping us to practice to strengthen our ability to bring our attention back to whatever it is that we're focusing on. So if you're building that mindfulness muscle and you're practicing mindfulness outside of work or outside of just this communication piece, then it almost becomes more natural and you're more aware of it. You're more aware of when your attention wanders and you're able to notice it and bring it back, gently bring it back to the conversation, gently bring it back to whatever it is that you're focusing on. And so I really encourage the use and practice of mindfulness, both inside and outside of work, both formally and informally, because they really go hand in hand and can help support us in both ways. So that's all I've got for you today. I want to make sure that these are some of my references, and I want to make sure that I get to any questions if you have any.
Yes. Okay. Hannah Gomez, our MS4 that logged on, has a question, and it's a great one, and it's complicated too. So she says, it's in the chat if you want to read it, but for the audience, I want to read it out since they can't see that part. So Hannah says, as a med student, I've experienced encounters where patients start to misinterpret rapport and empathy and begin to get too comfortable. In your opinion, what is the best way to balance the skills you're teaching to avoid unprofessional encounters? Fabulous question. And
that is a really good question.
You should definitely be a psychiatrist if that's your question for this after this presentation, right?
Yeah, absolutely. Because those in mental health, I think the boundaries that we face and kind of the boundary issues that we encounter in mental health are quite different from other areas like primary care. We don't hug our patients, and if a patient hugs us, it like suddenly becomes this whole like, oh no, what does this mean? These are the things that we think of in mental health. So that's a really excellent question. Hannah, I don't think there's I don't have a blanket response because it's so idiosyncratic, right? So some things it's about like culturally also what's taking place. What is a patient's perception of what's going on? What's our perception of what's going on? What is exactly like unprofessional? And, do we want to be cold, and is that going to be helpful, or what's going on? And I think as a med student, Hannah, I think that is also a big piece of it, is because sometimes we might be the patient has that notion of like, oh, this is a student, so they may equate that with maybe being I can talk to you in a different way or interact with you in a different way that might be not the same as a provider, like an attending physician, for example, or someone with the title of doctor already. And so I think the best way to do that is to maintain your own professionalism still in that. And you can be both professional as well as empathic and compassionate. It's not black or white, it's not all or nothing. And so just maintaining your professionalism and still maybe being able to say things, I think it really depends, but saying something like, well, in this interaction right now, I would prefer that maybe you don't call me like little girl. That's actually been something that I like one of the residents once told by a patient's family member. She just said like, oh, I really don't appreciate being called that. And so if you could please just make sure, I prefer to be called by my name. And so that way that there are still boundaries that are put up. But I think that over time, it just becomes something that you'll start to kind of notice your own style. And so it's important to introduce yourself in a professional way. It's important that you're not putting too much so as we would call like self-disclosure. So I'm not going in there and just talking about like me and my family. I'm really making sure that I bring the attention back. So being able to redirect. So for example, if a patient starts asking me about they're starting to get really chummy and they're starting to ask me about my personal life and it's something that's not relevant to them, I'll say something like, I appreciate you asking me about that, but I really want to bring my attention back to you. We don't have very much time and I want to bring my focus back to you. And so that's a way of doing it in an empathic and compassionate way and saying, I care about you and I want to bring it back to you. So I always bring it back to the patient. Patient-centered care, and also just making sure that I am maintaining my level of professionalism, that the language that I'm using fits with who they are and can connect with them, especially if, it's younger children, but also not being totally unprofessional to the point where they think I'm a friend, where they can still recognize my position in this interaction, in this encounter. And I'm sorry I couldn't give a more specific response, but it's kind of hard to give kind of like a blanket statement. So I'm sorry if that wasn't good enough.
That was great. And there's so many different levels of this sort of similar, that are sort of similar or in this realm. And a lot of them do take very different tacts in order to address them. So, if you all ever have these kind of questions that you wanted to consult with Dr. Longhurst about, or myself, just email us. We definitely, our emails are all on the Texas Tech website. So, and then thanks to Sarah Walker, she put a cool link there in the Melanie, you might like cool link in the chat for women doctors.
Yeah, I was gonna say, yes, that's another one. I've noticed some of our residents started wearing under their badge, it says doctor. And if they're called like nurse or miss, I mean, that happens to me too. I'll say, oh yeah, did you mean me? I'm Dr. Longhurst, just to clarify as a reminder. Because sometimes it can be passive aggressive, it can be a microaggression, and it's not always intentional, but they just kind of have this assumption. I think it's also important to remember that while we might have a lot of familiarity with who we are, roles, hierarchical, I'm a student, that's different from a resident, that's different from an attending. Patients don't always know. They just don't know. Sometimes it's just a lack of, they're not trying to be rude or mean or unprofessional. They just don't know. They don't know like the decorum that takes place. And so I always remind myself of that. Like they don't know mental health, like that they can't give me a hug. They don't know I can't accept these like really nice gifts. I'm not allowed to ethically. So I explain that to them and I have a conversation with them in a very, again, understanding and compassionate way, coming from that point of empathy. Like they just don't know. They don't live this day to day. They're just coming to see me. And so being able to provide a little bit of education in a kind, gentle way, I think can also be helpful.
And also, Melanie, I wanted to offer you like a couple minutes to talk about some of the programs that are still ongoing that are support for people in the behavioral health community, medical community, that sort of
Oh,
thing.
yeah. So if you go to our wellness, I think it's ttuhscp.edu/wellness. I want to say that, let me stop sharing so I can just look it up really quick, just to make sure I'm giving the right. So what we still have is we have some videos explaining what more on mindfulness. We have resources at this page, and we have other, let me just make sure. Yes, that's right. So we had a wellness tent, and that came down just a few days ago, like a week ago. But we have some videos on what mindfulness is, other stress reduction. We have a podcast that we did. It's called This is Wellness with Emergence Health Network. So a lot of really neat topics. There's a link there. So if you go to this website, you can just see a bunch of different information that might appeal to you and might support you in your own wellness and just practicing some of this. And then in terms of other just things that I would recommend, Headspace, YouTube has a lot of really good ones. Stop, Think, Breathe in terms of mindfulness exercise, so you can start to build your own practice and then try to implement it into your everyday lives. And then, of course, if you ever have any questions or would like to consult, please don't hesitate to reach out. I'm happy to talk with you.
Thanks. And I think NAMI El Paso still has a group, an online group for anybody who wanted like a more like a live action support type group for healthcare professionals. Look on NAMI's website. For anybody too that wants to, so of course it's the Child Psychiatry Access Network that funds this continuing medical education and nursing education series. We will have nursing creds starting at the latest in September. It could be sooner than that, but so if you guys know any nurses in primary care, you want to tell them, or mental health, they will be able to start getting nursing credits. But if anyone wants to sign up, if they work in primary care and they want to sign up for the official CPAN program, that's the one where you can get a consultation from anywhere from 7 a.m. to 4 p.m. on weekdays. Just let us know. You can email Joyce or myself. I think Joyce, and then Joyce has the survey in the chat also. If you guys can click on the survey, that also ensures that you're going to get your credit. And we have at the end, we'll ask if you have any additional interests that you would want to hear about in the field of, we're focused on child psychiatry, but anything that is somewhat peripheral but still connected, we can always do those. And again, the nursing credits will be soon. We're trying to, the next expansion we're going to be is to credit for, because we did not expect so many behavioral health professionals, other mental health professionals to be signing on. So soon we're going to try to give counselor and social worker credits. Right, Joyce? That'll be soon.
Very soon.
And you can see Joyce's email there on her photo. So yes, hopefully we're expanding all the time. Oh, and in the survey, we're constantly looking at your requests for future topics, and then we're going to look for additional speakers. So whatever you asked for will be on the list for next year. Our next academic year for this project is starting in August, right? No, September. We have everything planned through August. In September, we'll start with a new set of educational presentations. So let us know what you want. And the survey link is up above in the chat. If you scroll back to the chat, but then I think it goes out by email afterward. Is that right, Joyce? Already, it does.
Yes, I do send it out after.
Great. So thank you so much, Dr. Longhurst. I appreciate you having a speaker for us so much, and we will be asking for other sessions next time around. We'll give you a little break.
It was my pleasure to be here. Thank you, everybody. Stay cool.
Yes.
Bye.
It's supposed to be 108 on Saturday, so drink water. Bye, everybody.